There are three main compartments in the joint, and I'll demonstrate that by showing you a model of the knee. This component is the femur, and this is the tibia. And when I pull down this plastic model, I expose the patella, which is this bone. And so you have a component of the joint called the patellofemoral joint between the patella and the femur. And then you also have the medial compartment, and on the outer side you have the femoral condyle and the tibia. So this is the lateral tibiofemoral compartment. So you have the lateral compartment, the medial compartment, and the patellofemoral. But all these three compartments are interconnected. And so the pain may be in any of the compartments or in all the compartments of the knee. And this you can find when you examine the patient. Radiologically, of course, if you subject the joint to X-ray evaluation, there are four classical features that you'll find on the radiograph. Number one, between the femur and the tibia, you have what we call the meniscus. But in fact, covering the ends of the bone, you have the articular cartilage. Now, when the articular cartilage begins to wear, the radiograph will show a reduction in the height or the space between the femur and the tibia. So we'll say the patient has got reduced joint space. You can also have some knobbly swellings at the margin of the femoral condyle or tibia plateau. These are called osteophytes. In addition, you may find some thickening of the bone on X-ray, which we call subchondral bone sclerosis. And then in advanced cases, you can have subchondral bone cyst formation. So those are the radiological features that you may find.
Exercises are very good in the management of arthritis because what happens in arthritis, there's a lot of, apart from the pain component, there's limited joint range of motion, and then there's sometimes swelling. So exercises have been found to be a key instrument in controlling these problems. We recommend that individuals must cross-check their body fitness before they go into exercises. They should be seen by a cardiologist or a physiotherapist to ascertain if they are fit at all to participate in exercises. Also, it's important that the heart function is regulated such that exercise prescription is given based on what the individual can carry out. And some individuals can perform some levels of activity that other individuals cannot perform. These factors will be determined by both age, activity, level of activity of individual. An individual who has been an athlete, for instance, will be able to tolerate some exercise activity more than an individual who has not been athletic, or individual who has been sedentary will have to be started gradually and built up over time. The primary thing, as I said, is basically lifestyle modification. If you modify your lifestyle, lifestyle changes. If you are used to taking a lot of things that made you to predispose you to adding weight, you just try and cut them down. Dieting is a major factor.